Hello, and welcome to the Chest Journal's Editor Highlights podcast. Each month, Chest Editor-in-Chief Dr. Peter Mazzone highlights key articles from the current issue of the journal to help clinicians stay informed about new research in the fields of pulmonary, critical care, and sleep medicine. To introduce this month's episode, here is Dr. Peter Mazzone.
Thank you for tuning in to the Editor's Highlight podcast for the September 2024 issue of the journal Chest. We have a great lineup of diverse content in this month's issue. Over the next 15 minutes or so, I will provide a brief overview of key manuscripts published in each of our content areas. First, our asthma content area includes a research letter that describes the development of an upper limit of normal for CT airway mucus in older people without chronic respiratory illness, providing context for airway mucus occlusions as a target for treatment in asthma and COPD studies. Next is our chest infections content area. The clinical course of non-tuberculous mycobacterial pulmonary disease is varied. Understanding risk factors for progression may assist with management strategies. In this issue, Wang and colleagues present findings from an 11-year prospective observational cohort study of 477 patients designed to determine the rate of NTM pulmonary disease progression and the predictors of progression. 192 patients progressed during the study, 21% by year 1, 34% by year 3, and 43% by year 5, for an incidence of 11 cases per 100 person years. Female sex, an elevated sedimentation rate, FEV1% predicted, and the presence of a cavity were predictors of progression. These findings improve our understanding of the likelihood of progression and risk factors for progression of NTM pulmonary disease. Two additional original research articles complete this section. The first explores the relationship between lung volumes and heterogeneity in the response to elexacaftor, tezacaftor, ivacaftor in patients with cystic fibrosis and advanced lung disease. The second reports on the association between sputum culture conversion and mortality in cavitary Mycobacterium avium complex pulmonary disease. Our COPD content area includes a research letter that reports on the identification of pulmonary cellular toxicity in alpha-1 antitrypsin deficiency, and a chest review on pulmonary rehabilitation for individuals with persistent symptoms following COVID-19 infection. Next is our critical care content area. 4 clinical phenotypes for sepsis, differing in patterns of organ dysfunction, prognosis, and response to treatment, were recently derived from clinical and laboratory data. It is unclear whether the frequencies of acute kidney injury, acute kidney disease, chronic kidney disease, and acute kidney injury on chronic kidney disease differ by sepsis phenotype. In this issue, Molinari and colleagues describe findings from a secondary analysis of a randomized clinical trial of early resuscitation that included patients with septic shock, designed to address this question. Approximately 50% of 1,090 eligible patients had acute kidney injury. The frequencies of acute kidney injury varied from 26% to 78% across the 4 sepsis phenotypes. Variable frequencies of acute kidney disease, chronic kidney disease, and acute kidney injury on chronic kidney disease were similarly noted. The highest rates of acute kidney injury on chronic kidney disease were seen in the beta phenotypes, known to have patients who are older and have more chronic illness and renal dysfunction. The delta phenotype, noted for having more liver dysfunction and septic shock, showed the strongest association with acute kidney injury with an odds ratio of over 12 and acute kidney disease with an odds ratio of 9.2. These findings highlight differences in rates of acute kidney injury and acute kidney disease across clinical sepsis phenotypes. Also in this section is an original research article that explores venovenous ECMO candidacy decision-making, and another that reports results of a feasibility study of non-invasive electromagnetic phrenic nerve stimulation in critically ill patients. Completing this section is a special features article on the role of pediatric psychologists in critical care. On to our diffuse lung disease content area. Frailty has been shown to be an important determinant of outcomes in patients with fibrotic interstitial lung disease. In this issue, Guler and colleagues explored whether the clinical frailty score could improve risk stratification in patients with fibrotic interstitial lung disease by evaluating trajectories of functional tests in 1,587 patients in the prospective multicenter Canadian Registry for Pulmonary Fibrosis. Based on the clinical frailty score, 54% were fit, 25% were vulnerable, and 21% were frail. Frailty was a risk factor for early mortality and for larger annual declines in FVC percent predicted. Adding frailty to established risk prediction parameters improved the prognostic performance. These findings support the inclusion of the clinical frailty score as a prognostic tool when assessing the risk of pulmonary and physical function decline in patients with fibrotic interstitial lung disease. Completing this section is a research letter exploring sarcoidosis faculty development. On to our education and clinical practice content area. It is difficult to determine an individual's susceptibility to immersion pulmonary edema, a form of hemodynamic edema. In this issue, Druell and colleagues report findings from a case control study designed to determine if assessing right ventricle systolic adaptation during immersion is a marker for immersion pulmonary edema susceptibility. Immersion was found to increase the right ventricular preload for all 28 participants. In those without immersion pulmonary edema, this was accompanied by an improvement in right ventricular contractility, amplified by the negative static lung load. In those with immersion pulmonary edema, there was no improvement in right ventricular contractility, indicating altered adaptive responses. These findings suggest changes in right ventricular systolic function induced by immersion vary among divers and may help to identify those who are susceptible to immersion pulmonary edema. Completing this section is a scoping review on point-of-care lung ultrasound in emergency medicine, including an interactive database. Our pulmonary vascular content area is next. The comparative prognostic potential of available risk models for PAH prognosis and the applicability of risk scores in pulmonary hypertension groups beyond Group 1 have not been explored. In this issue, Yogswaran and colleagues report findings from a comprehensive analysis of predicted outcomes among 8,565 patients with incident pulmonary hypertension from the multicenter worldwide Pulmonary Vascular Research Institute Go Deep meta-registry, exploring the REVEAL Lite 2, REVEAL 2.0, Compara 3-strata, and 4-strata risk models designed to address these questions. All risk scores were prognostic in the entire pulmonary hypertension population and in each of the pulmonary hypertension groups. The REVEAL scores had the highest statistical prognostic power, while the Compara 4-strata risk score provided sub-differentiation of the intermediate risk group. Results were similar across subgroups of pulmonary hypertension. These findings support the predictive power of PAH design risk scores across a large pulmonary hypertension cohort. Completing this section is a How I Do It review of the use of sotatercept in the care of patients with pulmonary arterial hypertension. In our sleep medicine content area this month, there's a chest review on the cost effectiveness of sleep apnea management. Next is our thoracic oncology content area. Geographic disparities contribute to low uptake of lung cancer screening, but they do not completely explain gaps in access for underserved populations. In this issue, Welch and colleagues report on the use of the enhanced two-step floating catchment area model to evaluate how geographic accessibility, in addition to availability of resourced lung cancer screening imaging centers, contribute to disparities. Radiology technologist volume at each facility was used to estimate the capacity at each site to meet potential demand. 95% of the eligible population had proximate geographic access to an ACR-accredited screening facility. However, there was significant variation in availability with attenuation for most of the eligible population. Rural areas and areas with greater socioeconomic disadvantage were modestly correlated with lower access. These findings suggest that both geographic access and availability contribute to disparities in access to lung cancer screening. Also in this section is a research letter that describes thoracic surgery deserts in the United States through a geospatial analysis, and a chest review article of interventions that improve uptake of lung cancer screening. I encourage you to read our Humanities in Chest Medicine section, where you will find an original research article exploring facilitators and barriers to developing state pandemic preparedness plans during the COVID-19 pandemic, a case-based discussion of an ethically supported framework for determining patient notification and informed consent practices when using artificial intelligence in healthcare, and an exhalations piece titled Relative Value Units Belie Real Value. Also, I encourage you to read our commentary series, where you'll find a piece describing opportunities and challenges from the use of single and multi-cancer early detection tests. Finally, please review our case series publications for the month, which provide novel and educational cases to help improve your clinical skills. I hope you enjoy reading all of the high-quality content available in this month's issue of Chest. As always, I'm grateful to the authors of this work, the reviewers who volunteered their time to improve the quality of these manuscripts, and to our editorial board for guiding everything that we do. Until next month, I hope you enjoy the September issue.
Thanks for listening to the Chest Journal's Editor Highlights podcast. You can find the articles mentioned in this podcast and more on chestjournal.org. And if you're looking for more context and commentary on articles in the current issue, please check out the original Chest Journal podcast, which features in-depth discussions with the authors themselves. We'll be back again with more Editor's Highlights next month.